Hi everyone, I hope you guys are staying safe and healthy and doing well while we're doing this distance learning. I just wanted to make a video real quick on expectations for this course now that we're online, and also how you guys will be evaluated, since I know you guys had a lot of questions. And I've talked with Carrie about what is going to be happening, so I just wanted to share with you. And I really liked watching your guys' videos and seeing your face, so I thought it might be nice if I also did a video instead of just an email. I apologize if you hear my son in the background, he's with me as well. So first, we'll just go over expectations. Last week, a lot of you guys had either turned in stuff late or maybe didn't turn in all of your assignments. And I know it was definitely a learning process. So there was a lot of leniency that does not count against you, but starting this week, that will count towards your professionalism. You need to be turning in all of your assignments on time. So make sure you're either turning them in through Blackboard, or if there's not a spot in Blackboard, so like your ATI scenario reports or your nursing process worksheets, you can just email those to me because I'm grading all of your assignments. So you can just email me whatever. It doesn't have a specific spot in Blackboard to turn in. If you are having problems with your computer, whether ATI is just not working, make sure you notify me ahead of time. Don't wait until after the due date, or don't make me email you or track you down to see where your assignment is. If you're having problems, let me know ahead of time, and that's okay. I know there's things that are out of our control. If it's ATI, maybe try opening up that website in different browsers. I know sometimes that has helped for me in the past. So if you're using Internet Explorer, try Chrome or Firefox. And if that doesn't help, then contact the help desk and then just let me know what's going on. So yes, just please turn in all of your assignments on time. Also, make sure that you are spending enough time on your assignments and not rushing through them. So your scenarios should take more than 10-15 minutes, because these are supposed to make up for your clinical hours. So instead of doing 9 hours at the nursing home, your assignments shouldn't take 9 hours, but it should take you several hours to do this, because we're trying to make up for time lost in clinical. So that is also how we're evaluating your clinical experience. So, I can't watch you obviously talk to patients or give medications anymore. So whatever you're doing in the ATI scenario is going to be reflected on in your overall grade. So make sure that your report and all of your scores are okay, and that you're spending enough time on them. So if you notice that your overall score says needs improvement, or you're scoring a 0% in safety, that is an issue, and I would highly recommend that you redo that scenario, because like I said, that will be included in your evaluation overall at the end of the semester. Another part of your evaluation will be the videos that you turn in. So get creative with them. If you have family that's willing to be taped, use them. I enjoyed seeing some of your family members last week. So use them as patients. If you don't have that ability, then use a stuffed animal. If it's education like it is this week, you can just talk directly to the camera. Just make sure you're actually talking to your patient or your family member, the stuffed animal, the camera, as you were a patient. Also, make sure you're wearing your scrubs so that you look nice and professional. Because this is, like I said, this is also another way to evaluate your performance instead of watching you in clinical. I also would recommend that when you're doing the ATI scenario, that you are taking notes, so that way you have some kind of ideas in mind on what you are going to reflect upon in the CET. So if you notice some good communication between the nurses, or the nurse and the patient, or maybe bad communication, just write down a little note, or maybe the choices that you made, you can reflect upon that as well. So make sure you're writing some notes. Also, you can reflect on the videos that you made. So the videos will probably be reflected upon in different sections of the CET. So here's my son. Sorry, he's gonna join us. But so like last week you did the med administration, so that would go under safety. This week you're doing education, so that could go under health promotion. And I know, and if I think the last week you'll have to do assessment, so that could obviously go under your assessment portion of the CET. So for the CET, make sure you're reflecting on what you actually did in the scenario or in the video, instead of like a hypothetical situation. So for safety, did you see something, or did you choose something that was safe or unsafe in the scenario? For assessment, that you're a little bit limited because they don't do obviously like a full head to toe assessment in the video. So just reflect on any assessment piece that you noticed the nurse is doing, or any assessment pieces that you had to choose. And then for the health promotion, or not health promotion, the nursing process section, so like the analysis, interventions, outcomes, evaluations, you do not have to rewrite what you put in your worksheet. Save yourself the time, only reflect upon, was it easy this week, was it difficult this week? So for example, you could put, I've taken care of a patient that had a UTI, so the nursing diagnosis was easy for me to make. 2-3 sentences, does not have to be a lot, because I will be looking at your worksheet while I'm looking at your CET. And then for communication, health promotion, professionalism, reflect upon what you're either doing in the video, if it applies for that week, or what you've seen in the scenario. And then for your commitment to learning, do what you guys have been doing every week so far, which is to find an article that relates to the topic for that week. So like this week, UTI, urinary elimination, and then just put a link in to that article. And then also, what did you learn from that article? So for your evaluation, you're obviously going to be evaluated and graded on what you're putting in your CET, your overall score and report from the ATI scenario, and then your videos, like how well you're doing in the videos. And then for professionalism, are you turning in your assignments on time? Are they completed? Things like that. So hopefully this video helps and cleared things up on what's expected. Please reach out to me if you have any questions, or if you have any further questions on how you'll be evaluated or graded at the end. So please just feel free to email me, reach out to me for anything that you need, and I will talk to you guys real soon. Thanks.